The Council of Governors has asked the national government to avail the required resources in the event it agrees to implement the 2017-2021 collective bargaining agreement with the Doctors' Union. The governors also want the CBA to be reviewed, saying that full implementation would have a huge financial implication on the county's budgets. This even as the Central Organization of Trade Unions says it is in consultations with the Ministry and the Medics Union to find a solution to the doctors' strike. Martin Mwangi with the details.
Through a letter to the head of public service, Felix Koskei, the Council of Governors has decried lack of funds to enable them implement the 2017-2021 collective bargaining agreement between the doctors and the national government. The governors say the national government committed to fund the CBA, which provided for enhanced basic salaries for the doctors, but that has not been honored, and county governments have not been funded to enable them to pay the arrears accrued from the basic pay. The governors want the national government to release the required funds in case it agrees to implement the CBA.
The whole budget of all the 47 counties for the health is around 120 billion. You will still find the Ministry of Health and MOH retaining a whole whooping 185 billion just to do the coordination work that they do.
The governors also want a review of the CBA between KMPDU and the national government, saying it has components which are difficult to implement.
A CBA that talks about interns being recognized by the union, yet they are not employees of the OMH or Council of or the county governments, then there is a problem there with our CBA. And therefore we need an interrogation of that CBA. We need to go through it with a tooth comb to ensure that we are talking about CBA that may be warranting a strike.
Central Organization of Trade Unions CoG Secretary General Francis Atuli says the union is in talks with the Ministry of Health and the Union of Doctors in order to amicably resolve the doctors' strike that is well into the 4th week now.
We are consulting. I have been in touch with the minister this morning. Tena ndio malize ndio nataka kuwa in touch na chama. We can narrow the gap on issues na tupata return to formula. Madaktari warudi kazini.
Martin Mwangi, NTV.